This increase includes a substantial allocation of rupees 2,143 crore under the Production Linked Incentive, that is PLI scheme, dedicated to developing, improving and maintaining pharmaceutical production. We will delve into these increases and what they signify for the future of pharmaceutical development and traditional medicine research. Furthermore, the Ministry of Ayush has received notable 23.75% increase in its budget, reflecting the growing recognition of traditional medicine, research and its integration into our health system. Our panel today will help us navigate these changes, offering insights into how this budget could transform healthcare delivery, enhance disease control efforts, and strengthen regulatory systems. So whether you are a healthcare professional, a policymaker, or simply someone interested in the future of health in our country, stay tuned. We are set for an engaging and informative discussion that promises to unpack the complexity of the budget and its impact on all of us. Thank you for joining us today. Let's embark on this exciting journey through the 2024-25 health budget together. Let's meet our panel to expert and start our discussion. First of all, I would like to call Mr. Rajiv Nath, Managing Director of Hindustan Syringes and Medical Devices. Second, Dr. Rajiv Gautam, Corporate Officer of Horeba Limited, Japan, President of Horeba, India. Next, Dr. Rajiv Chibbar, Vice President of External Affairs at Sahajanand Medical Technologies. Dr. Anshuman Kumar, Robotic Oncosurgeon at Dharmashila Hospital and Reason Center. Next one is Dr. Suman Gupta, Director at Metro Cancer Institute. Some of our esteemed leaders have joined us online. Those are Dr. Mini Bodhanwala, CEO of Wadia Hospital, Mr. Sunil Khurana, CEO of MD of BPL Medical Technology, and Manu Malhotra, Director of RSMS Architects. Now, I would like to convey my message to my co-host to take this discussion further.
Yeah, thank you, Ritika, for wonderful introduction and for laying out today's agenda so eloquently. Good evening, everyone. And I am your host. As you know, my name is Afzal Kamal, and I am running this media house for last 15 years. And so we are going to analyze this budget today with all of you, and definitely this will take. So first, and we are eagerly looking forward to your expert insight, especially on the crucial topic of healthcare. As we discussed and debate the nonsense of this year's budget, your perspective will be instrumental in helping our audience understand its implication. The healthcare sector has been a focal point of this budget, with significant allocation and reforms aimed at transforming the landscape of medical services in our country. We have seen proposals that promises to enhance accessibility, improve infrastructure, and boost innovation. But what do these changes really mean for the common citizen? Are these measures enough to address the pressing challenges we are facing? Today we have gathered some of the brightest minds to delve deep into these questions. Their analysis and viewpoints will shed light on the potential impact of the policies and help us gauge whether the budget meets the expectation and needs of our healthcare system. Without further ado, let's get started. Now let's proceed with our first topic of discussion with our panelists. So I will ask the simple question to every panelist to start with: how do you see this year's budget? So starting from Mr. Nath.
Thank you, Afzal Bhai, and thank you for inviting us to this show. Well, this year's budget, it was highlighted in the parliament as a hopeful budget. and we were very hopeful when we were hearing everything. However, at the end of the budget, I was feeling a little bit lost and desolate. How do I feel now? I still feel hopeful. We are always optimistic, and we hope that, as the FM mentioned in a speech, that this is an add-on to the interim budget announced in February. It's still a work in process, and hopefully going forward, there'll be more announcements and more notifications that will come forward, because it's not the usual once in a year budget.
Thanks, Abjal Bhai. Again, thanks for inviting us here in this panel. And what my friend says is right. But I'm a little more disappointed because if India has to become 5 trillion economy, it has to be make in India, it has to be much more, health has to be the prime situations, and health has been the subject of the elections over the years. But suddenly is taking a different steps. As you said, that we are all hopeful that still something can come up, or we find maybe finer points in this budget that maybe this is beneficial for ultimately to the patient, to the common people, for the society. Thank you.
Thanks, Afzal Bhai, and thanks, Medgate, today. I think I echo what both Rajivji's echoed. It's a namesake. We can't, banish it in that way. But yes, we initially thought the budget, when was discussed with us at various association meetings, had inputs from, I think, each and every sector. The medical device sector, we provided very, very valuable inputs, not only looking at manufacturing being at par to global practices, not only inverted duties being highlighted, or even the growing imports that has really been an issue with the government or an issue with India as such. So we were hoping that the budget looks into this in a very, very holistic format. But nonetheless, I think areas that the Honorable Finance Minister looked at, and especially when she talked about the 9 policy areas or the 9 commandments that we can say have really unfurled the fact that we will now move in a very focused manner, but then not inching towards the SDGs by 2030, because this is something that is just a recap of the last almost a decade of what we were seeing: skilling, jobs, manufacturing, make in India, as Rajivji just alluded to. Something that we need for the healthcare is not clicking within the system itself. So I think when we were hopeful, we were really hopeful.
Thank you, Afzal Bhai, and thank you, Medgate. So, as the industry tycoon said that this budget had a lot of hope, as a clinician, I am basically a primary physician or a doctor who deals with this. The only thing which was different was that few drugs, 3 drugs to name, were exempted of duty in this particular budget. But I think the basic problem with us in healthcare right now is that it is not just 3 drugs or 4 drugs. We need something more of a blanket exemptions or something where the drugs can become more affordable. Although for the generic drugs, I think India is doing a very good job, which is a ray of hope for all of us. But then again, we have to realize we have a lot of imported drugs, especially in our segment oncology, which is like the most smallest nascent branch in the medicine community, and we have the maximum number of research drugs. So something has to increase for the research part and also for the imported drugs, something more affordable for our day-to-day patient practice.
Perfect. Thank you. Actually, legal system, medical, and economics, there are 3 systems very difficult to understand by a common people. And for non-doctors, medical appears complicated. For judiciary, medical appears complicated, something like that. But there's a book, Psychology of Money, read it. That describe health and money. There are only 2 things important to everybody. Whether you like it, you don't like it. Therefore, thanks to Bedgate today, who chosen the topic out of entire budget to discuss the health budget. Because I'm a cancer surgeon, my role is to dissect, decode, till the time I reach to the root of the system. If you ask me, how do you rate this budget? Forget the rating. I'll tell you, if I say rice and pulse soup with a smashed potato fried in onion with cumin powder, you'll think it's a marvelous something fantastic dish. But frankly speaking, it's a khichdi chokha Bihar. It's nothing else. Right. Therefore, to understand anything, expert needs to decode the thing for the public. And thanks, in this era of media, Medgate is doing, it's a commendable job. Moreover, we'll discuss, yes, exemption of 3 drugs. Anyone can clap, and many print media highlighting in the half page that this has been done, fantastic job has been done. We'll discuss food, how subsidy from 3F has been removed, food, fuel, and fertilizer. We'll decode that as well. What has happened to environment and public health? We'll discuss everything in due course.
So, Ritika, you have any question from industry side?
As we have discussed many about cancer, so my question to this only, in long-term benefits. So basically, I'm asking this question to both of you. So how do you anticipate that the custom duty exemption will impact the long-term strategy for cancer care in India? And the second part of this question, will it contribute to a more sustainable and equitable distribution of cancer treatment across different social economic groups?
So, come to your first question first.
Yeah.
As Dr. Anshuman rightly said right now, and he wants to come to it this later, 3 drugs have been exempted. Do we know what is the magnitude of these 3 drugs? How many people will benefit from them? So if I tell you the drugs which have been exempted are called as, one is a tablet called as osimertinib, which is used in lung cancer. Another is durvalumab, which is again a immunotherapy used in lung cancer. And the third is a breast cancer drug. Okay, so these 3 drugs are something which is just focusing on one single segment. So basically when you talk about cancer, it is a bad word. We feel sad for the patient. We feel sad for everything. But you have to understand it is not just one disease. It is around 200, 250 diseases. So the number of molecules, the number of drugs used to treat them is somewhere more than 500, 600, running around 1,000 nowadays. So just giving a subsidy on 3 selected drugs is something which is, I feel, to the people at affordable price of 10,000 rupees per month equivalent. So we have to basically empower our own industry. We have to get more, I will say, knowledge sharing with the international things, because cutting the cost of something which from 1 crore to 90 lakhs is not going to help many of us.
So this is not the root solution of this case.
Yes, looks nice, as Dr. Anshuman also said, looks nice on the newspaper for cover page, but in reality it will not change anything.
Decoded, it is not.
Yes. So on a Monday morning, it is not going to change anything in my clinical practice, or it is not going to benefit any one single patient more.
Yeah, to extend, dissect, and dig out further. Because already Sumant has explained everything about drugs. No need to explain now drugs. 2 drugs has been approved in India since 2018, right? Still under drug price control. There's an act passed in 2013. That means this drug is non-scheduled medicine. For public, I would like to explain what does it mean. It means manufacturer, supplier, or marketer cannot increase the price more than 10% per year. That is the meaning. But publics understand drug price control is something magic. No. There's a control on increase on the price per year, right? Another drug is launched in January 2024. The trastuzumab, trastuzumab, right? Yes. That's it is in fact January 2024. 2 months it is available. Right? Now move further. There's a combination of 2 molecules. One molecule which is actually immunotherapy, trastuzumab, already under usage, widely usage, proven, well level 1 evidence. It's capping has been done under National List of Essential Medicine, NLEM, and pricing is 54,725 rupees, upper limit. You can't sell in more than that.
You are very good with numbers.
Yeah. And that actually covers HER2 positive breast cancer case, 60 to 70% group HER2 positive, and only 12 to 14% equivocal or low probability positivity, right? Which is we are discussing with the new drugs. Now, this market, 54,000 is the upper limit, but many companies, because now it's out of patent license, it's selling it 15,000. Why government is not making capping at 15,000? That company is again getting profit?
Yeah.
But no. Now move further. The market share of annual turnover of one durvalumab, that's drug, is 28.8 crore.
Okay.
Second drug, osimertinib, market share is 52.4 crore. The drug, which was launched in January, suppose if I project something, in this year, market cost, it will take around 45 crore. Total, 125 crore. 10% custom duty reduction, 1 crore 25 lakh. 1 crore, no. Total market share means total benefit per year to the consumer will be 1 crore 25 lakh only, which is being projected in most of the print media, and an unfortunate majority of the doctor is giving statement and bite on the media that this is a miraculous budget. Move further. When the budget was passed? July 23rd.
Yeah.
David Lammy, who was foreign secretary from UK, he came to India on 24th. It's our Gulami Mansikta, which is not going out our East India company. And just to please them, these all three drugs belongs to only one company, AstraZeneca.
Okay.
Nobody is discussing this issue. Why it is not being custom duty has been removed from any other company? Trastuzumab, which is required for 70% of HER2 positive breast cancer, belongs to Roche. Just to give them competition, this AstraZeneca, and please David Lammy, this step has been taken. Now move further. Next day, just at the day of budget, 13% rise in AstraZeneca share.
Oh.
On 22nd, the total asset of AstraZeneca India was, first compare year to year, there is a 28% rise. Same day, 13%, year to year, 28% rise. The share market of entire global AstraZeneca fallen down when COVID vaccine dispute came into the market. Now this is rise is 13%. Move further, 1 crore 25 lakh. How many holdings? How many advertisement you can give? No, not much. Now duty reduction of 1 crore 25 lakh, welcoming garlanding David Lammy, and AstraZeneca profit is 840 crore in one day.
Rightly said, Mr.
This is, and now Ministry of Health and Family Welfare giving headline, in view of 27 lakh cancer patients, we have taken this decision. No, these combined all three drugs will not cover even 50,000 patients. Forget 27 lakhs. It's all eyewash.
Okay.
My problem is, those who understand Ramayana something, सचिव वैद्य गुरु तीन जो प्रिय बोल ही भयास राज धर्म तन तीन करी होई बेगहीनास. सचिव मतलब सेक्रेटरी जो हमारे ब्यूरोक्रेट्स हैं, वैद्य मीन्स डॉक्टर, गुरु टीचर, प्रिय बोल ही भयास अगर डर से प्रिय बोलने लगे, राज जो हमारा शासन है, धर्म तन, वैद्य तन को ठीक करेगा, होई बेगहीनास, तीनों का नाश हो जाएगा. इसलिए डॉक्टर को झूठ नहीं बोलना चाहिए. Thank you.
Yeah, rightly said, Mr. Dr. Anshuman. So actually this is the budget. So I have talked with most of the people from industry, to many doctors behind the camera and many industry people. So actually this is the budget we are seeing for last 5 years. Same budget is there. Some they are allocating more money to this budget, but industry is quite not happy with this. So if our industry will
we should dissect that as well. The increase in amount in relation to increase in the consumable cost and increase in the population. If you adjust it, it's not increase, it's decrease.
So overall, I am saying, Ritika will explain this in more way. So our health budget is only 2.5%, I think.
No. 1.6% was last year. This can increase to
1.9%, but other country is 2.5%. Other countries aim is 2.5%.
Again, there are 4 formula to calculate health budget. 4 formula. The most pessimistic formula which guides India says 5% of GDP must be at health.
Yes.
But at least we demand 2.5%. At least.
At least we are demanding 2.5. Like
So to
Germany.
this budget to 2.5, we must strengthen our Make in India initiative, and I am also
Say nothing in the budget. Interim budget actually has been merged into the union budget. So I think paucity of time for the finance minister. You can't allude to something that you've already talked about. She's moved a step forward to give you more nuances on what the government's vision is. But yes, when you look at digitalization, lot of areas in electronic component manufacturing, how is that dovetailed? Is the industry really going to benefit out of it? Is the PPP mode really going to take forward from that?
Very less contribution in health and research.
Yeah.
Like only
So that is basically, so that is to basically, answer your question, the skilling and the upskilling that, was referred to, that is where, more and more research can actually come. If we have more scientists, if we have more people in the R&D sector aligned to the healthcare vision of the government, aligned to the industry's requirement, it will be more beneficial. So, Bilkul. Or from a scale committee perspective, there is a scale committee that the ministry had, and as an association, we did do a representation. It recognized that a whopping 32 lakh people need to join the healthcare industry if India, when it inches towards the 2.5 or 30% GDP mark, requires. So you can see the number of people that is required. So yeah, skilling, upskilling is important.
And Dr. Gautam, your views on this?
To understand the percentage of allocation. Right now we have reached 1.9% of our GDP for health. Out of those 1.9%, 1.2% of all those 1.9% goes to research, medical research. 0.6% goes to prevention. Prevention means किसी बीमारी को रोकना, right? And that has become dark hole because you are not preventing the diseases. Whatever you create the hospital, how many EMs you can create, but you have to increase 0.6%, strengthen PHC, because all patients are moving towards EMs. No need. US is spending 16% of his inflated GDP for healthcare, and 93% of American population metabolically ill. Do we want a country like US? We have to plan strategically, and like IAS, IPS, we should have Indian medical services. Qualified doctors should go to administrative services, qualified doctors should go to clinical services. That should be the idea.
That's a very great
Right.
idea.
Thanks. Little bit, let me change the taste of the debate from a little bit of negativity to the positivity. And I come to the point of the Make in India. I have different thoughts.
So this is not negativity, sir. This is
A fact.
government.
It's a fact.
This
It's
is
a fact.
supporting government.
Yeah,
How
fact.
we can improve us.
Fact versus looks like
Yes.
negative.
Right.
Yeah.
See, Make in India, I divide into 3 parts of the Make in India. Make in India, people don't understand. First is the research, second is the development, third is the manufacturing. I think the government is trying to do everything together. It is not possible. Research and development is related to the education. As somebody says, skill. Okay.
Yes, yes.
We don't have, we can give any money, but do we have the scientists? Do we have the doctors for the research to developing? For a new drug requires millions of dollars and is a huge investment. I don't think that's the India's need today. India's need to do the manufacturing here first. We do the first thing which is right we can do. Like, just to give an example of Hariba, we don't bring any research and development to India. If there is we have 49 companies. If somebody has developed and the research and development, we'll keep it there. We don't float it everywhere. Right. Manufacturing, we do the locally.
Okay.
And we give the royalty how to run the R&D also. How you have to give the feed also to feed them. Okay. So that's, I think first model should be here. maximum manufacturing should be done here instead of import, but then the import lobbies, other things, then a different issue which we are just discussing. I don't think that we are ready, or we will be ready in next 5-10 years for the research here. Okay, let first get into that kit 50 to 70% of the healthcare, the devices, the drugs, and everything. We can do it here, reduce the cost, availability, everything. It will give the skill. I think manufacturing skill this country has, that should not be a problem. Employment, it will help. Then slowly we are what Dr. Anshuman said. This point, this increase this budgets of the R&D and education and other things. It has to be complete way. It cannot be just increase the budget of the R&D. It will happen. How many institutes in how many universities has the medical education? Yes. How many? I don't know. Even the AIMS, we are supposed to do the research as well as the treatment. How many hospitals see only the patient, medical college only treat by the PowerPoint presentation? Yes. There is no connection between that. Yeah. True. So that's a maybe little.
Cannot take India towards EODB. So that's my take on this.
थैंक यू. एक तो राजीव साहब आपके सीरो मैन्युफैक्चरिंग पर चुटकुला बता देता हूँ. When it was British government, the most famous needle, सिलाई की वाली सुई, was from Japan. There was a joke. Japanese asked, Japanese, Chinese and Indian, three friends were sitting. Japanese asked, I created this small size needle. What have you done? Then China told, I put a hole to pass the thread in. Then both asked Indians, what have you done? I printed made in India. That is actually pseudo manufacturer. Now coming to, in one word, you asked me. Yeah. One word is khichdi, right now. Okay. Budget as well as healthcare of country is khichdi. Why khichdi? Nobody understands the healthcare properly because इतिहास के पन्ने पढ़ के नीति बना रहे हैं. First, understand medical, how it should run. Understand health economics, how we can run it, and how we can strengthen our health economy. Put pressure, put strength on wellness program, prevention program. India, top problem, hypertension, diabetes, even youngsters, children, kids, diabetic, cancer, and obesity. There are 4 major problems. What wellness program do we have for that? First, reduce the burden, healthcare burden, save money. And second, bring medical tourism. We call it virtual medical tour. From people from Asian countries, Gulf, African country, they want to come to India. They think because of British colonization, they are the same people like us. We can bring economy to government hospital, not to private hospital, to government hospital, and chunk, we can increase the government revenue, and that government revenue can be utilized in our healthcare economy. That should be the idea. Then wellness program doesn't mean allocating certain budget to Ayush Mantralaya for doing research on Gomutra for cancer cure. That is not possible, impossible. Then what do you have to do? Even don't start bridge course, means training Ayurvedic doctor for 6 months writing paracetamol, ciprofloxacin. No, that is not the solution. Solution is integrate the system. Wellness program, Ayurvedic doctor, homeopath doctor, allopath doctor, Siddha, Unani, and naturopathy. We have 6 systems of Indian medicine. Means 1 is imported, modern, and 5 ours. Integrate all those systems. Take help. For example, a patient is coming with hypertension, right? In that clinic, Ayurveda people is also sitting and they can advise the lifestyle. Do this, do that. Naturopathy, advise the lifestyle. We can cut down the program, reduce the heart attack, reduce the cancer risk. Our money will be saved. That should be the idea. If you want, you can pass it to Niti Aayog, ICMR, as well as Health Ministry and Finance Ministry. If you do that, in 5-year course, brake will start applying. Because we are on accelerator pedal right now. And 10 years after the day they start this, we'll see the change. And definitely I am full in conviction we'll see the change.
I'm very impressed by what you said. It's a very nice thing, and we will definitely try to pass this thing to our ministry.
So we are talking a lot of manufacturing, we are talking a lot of beds, everything. Yeah. I think, do we realize that what is the common cause of illness? The maximum 65% of cancer or heart disease is just because of 2 tax earners. And your 2 tax earners are alcohol and tobacco. So you are earning X amount and spending 10X amount by curing those things. So basically, whatever we all are talking is very nice to hear these figures. But the reality is, if we stop earning tax from these 2 things, we will not be needing an increased healthcare budget. This budget will suffice. So we have to talk about primary prevention. Disease hone ke baad, we don't have to discuss. You have to understand the root cause. Root cause is
गुरुजी व्हाट इज योग?
हाँ.
योग चित्त वृत्ति निरोध, चित्त की वृत्तियों का सदैव के लिए रुक जाना ही योग है. माइंड स्टफ.
Yes.
Everybody is stressed. I don't know for whom. Everybody is who is happy. And fourth is sleep. Nobody is sleeping.
Yes.
Either they are working in the bed, means while so-called sleeping, but no sleeping. If we want to start a wellness program, this should be the idea. And meal includes everything. Tobacco, alcohol, everything. One word.
Long way to go.
Long way to go. Okay.
Nicely said.
So I would like
So before we go to for concluding remark, Ritika, I have some points. So what I am saying is from my analysis that this budget should be aligning with government long-term economics and social goal with PM Viksit Bharat.
Yes.
PM has really a long vision, but our bureaucrats, our industry leader, the around peoples are not giving good ideas for implementation. So we have to reach in positive way, and we have to try to meet with the delegations. So Medgate is also a platform, and there are many platforms like bigger platforms, AIFAK is there. But Medgate today is only healthcare related issues are raising to the government. So I urge here to our viewers and industry leader to join our movement Medgate today and its association like IGHM and GMAF, and take this forward. Like you are running IMED only for the medical manufacturer association, and other is for diagnostic. So they are doing good job. So in totality, healthcare, Medgate today is there. So doctors, healthcare providers, and diagnostic owners should join our movement. So strengthening public health is also more important for our infrastructure, and we have to see in a significant focus on that. And we will request our finance ministry and PMO and health ministry to allocate more fund in upcoming budget. So this is my analysis, and this was a wonderful debate with all of you. Thank you so much for joining.
Debate was positive.
Yeah, thank you so much for
ending this debate with awareness. I would like to ask, according to you all, what is mental health in India? I'm not talking about Western, but what is mental health in India? How, like we see that in this budget, Nirmala Sitharaman ma'am has focused on giving more fund to mental health initiatives. So how do you see that the PMO or the Ministry of Finance or the Ministry of Health should focus on mental health initiatives, and especially in India, how to tackle that? If you have any initiative in your mind and you want to convey to our viewers, please say it.
So I'll start on behalf of Dr. Anshuman here.
Okay.
Yes, he will finish this. So mental health is something which is not existent in India because we are afraid of the topic of mental health. We are thinking that mental health means pagalpan ya koi pagal ghum raha hai. Mental health is not that. Mental health is something what he summarized, that it is something of a wellness. So wellness is not only physical wellness, it is mental wellness. So mental wellness is a very big dimension, I think, which requires a bigger debate than this. But the primary thing for mental wellness is understanding what is a mental.
People think it's poverty which brings mental.
No. Absolutely wrong.
When you go towards self-actualization hierarchy of Maslow's need hierarchy theory, only then mental health problems starts. In the third phase. In the third phase, when you start thinking self-esteem, ego, why people not recognizing me, that is mental health, right? Then 3 level is required. Number 1, individual. Okay. Every person has to understand, as Sumant told, am I right? If not physical, then mental. Even basic anxiety, panic attack, persistent stress, is mental health. We have to understand at community level, community is family, as well as the people around you, workplace. Positive work environment. How we can bring it? There is a concept ikigai from Japan, from sir your company, horrible country. Ikigai, where your passion, mission, vocation, profession meets, do that work only, don't do anything. In India, everybody is craving, boss kharab hai, office अच्छा नहीं है. But why you're going there? Then start passion, mission, vocation, everything there in your office, whatever he is doing, right? That is community level. And the government level, government should just understand mental health issue is a issue, but it is not a big issue that cannot be tackled. From primary health center to basic clinic, from everywhere, we can start mental health support. It doesn't mean always psychiatric hospital, right?
I just wanted to, he took the name of Japan, so I said, yeah. So
as